Okay, welcome everybody. Please, if there is some questions, just raise your hand and I will be able to answer. All right, so welcome again to our review for the midterm anatomy physiology. We are going to start from lecture number 1 and welcome everybody again. Okay, so as you can tell, we are going to see, we have different type of anatomy. The anatomy that we are going to talk all this time is about the gross anatomy. So it's the description of the organ. And we need to remember some few names from some terms. Physiology is the study of the function. Pathology is the study of the disease. Okay, so we have the cell organization, and the cell organization is important. Why? Because you can see how the tissues are being organized from smaller structures to bigger structures. And what is remarkable here, what I want you to remember, is the organs are different to call systems, organs and systems. Organs are going to be the stomach, for example, the pancreas, but a group of organs are going to form a system. A system, so we call the GI system. GI system, for example, is divided into the GI tract, that is all the tubing, all the esophagus, stomach, sorry, and the accessory glands that are part of the GI system. So we need to just remember that differentiation between organs and systems. Okay, so we have 11 systems that we need to remember. So what I want to remark is about the integumentary system. The integumentary system, sorry, I'm going to mute everybody. I can hear some noises. Just a moment, please. Okay, there you are. All right, so here we have the integumentary system, including the skin, the hair, and the nails, right? All right, so integumentary system. Then what I want to remark about this before we go into our main topics is that the difference between, oh, by the way, we have different tissues that we are going to see in a few moments. All right, about metabolism. Metabolism, again, it's very simple. I'm not going to go into much detail because we already know metabolism is how to produce energy, right? Another way to define metabolism is catabolism plus anabolism. Homeostasis is so important, this word. Homeostasis is the correlation. Remember, we was talking about an endocrine. We have the hypothalamus, that is central nervous system, and the pituitary gland, that is an endocrine system that is going to form the homeostasis, the internal balance. Very important to remember about the extracellular and intracellular fluid. Extracellular fluids. So intracellular fluids, where everything is inside. But extracellular fluid is going to be everything that is outside the cell, and that includes the blood and plasma and the fluid that are in between the cells. Okay. All right. So for this, what I want just you to remember is this: that the body has about, in adult life, about 60% of the weight is going to be water. When you are newborn, 80%, and when you're getting older, you're going to have about 55%. It's important to know about this. Why? Because in these spaces are going to play a role all the electrolytes, right? So the intracellular, we have potassium and phosphate. Remember, potassium, the most common intracellular cation, and the most common intracellular anion is the phosphate, intracellular. And outside is going to be in the blood plasma or in the interstitial fluid. It's going to be the sodium and potassium. Okay, sodium and potassium. All right. So The body cavities is something that is at this level is basic. So you need to remember about the dorsal and the ventral. Dorsal, don't get confused. Dorsal is posterior and ventral is anterior. The ventral divided in thorax and the abdominopelvic cavity. So please, it's not just abdomen. It's going to be divided in thoracic cavity and the abdominopelvic cavity together, because the abdomen and the pelvis do not have a division as, for example, the thorax has the diaphragm divided, but here we don't have that. All right, so we have very important here and very high yield is the regions of the abdomen. First of all, let's go to the easy one, that is the 4 quadrants. In these 4 quadrants, you have the center, where is the crossing of the lines, is the navel. Okay, so that is the area where you're going to divide the 4 quadrants. We need to remember these regions. The right hypochondria, that is the liver. You can write down if you have the page in front of you. The stomach, epigastric, spleen in the left hypochondrium, the left lumbar descending colon, umbilical region is the small intestine, right lumbar region is going to be the ascending colon. The lumbar areas are going to be called flanks. The other name, flanks or lumbars. We have the iliacs here, the iliacs, and the iliacs are right and left equal to the as inguinal or iliac. You must know that. You need to remember here is we have the appendix. In the hypogastric area, we have the uterus and the urinary bladder. So if you see here, this is the pelvis, right? And you can see here is the pubic bone. So the urinary bladder is going to be under the upper border of the pubic. So it's not going to be the urinary bladder here, but it's going to be under the line on the top, from the top of the pubic bone. That is the urinary bladder. And here and there we have the uterus. The left iliac, the nursing consideration, we was talking about enemas, and these enemas actually make you make the patient lay down on her left side, right? Okay, so that is about the regions of the abdomen. Okay, so let's keep moving. So the planes, just to mention, sagittal plane divide right and left, right? Frontal plane is going to divide anterior posterior, and the transverse plane is going to cut into upper or superior and inferior. Okay. All right, so we have here the structures of organs according to the regions. So at least I want you to remember one. I will be more than happy if you just remember one of these. If there is more, it's okay, but at least one. All right, so about chemistry, just remember that we are going to talk about the compounds. And these compounds are going to be a group of molecules, right? A group of molecules. So atom, one atom plus another atom is a molecule. They can be, if they are actually different, are going to be called compounds. So that means, for example, atom A plus atom B, that is going to be a molecule, but at the same time is a compound. Okay, so the chemical bonds are the ionic and the covalent, and the covalent are more stable than the ionic, right? Covalent, for example, who are covalent? The covalent are going to be all the organic, mostly all organic components. Covalent is going to be fatty acids, for example, molecules. For example, ionic is going to be sodium chloride, and they can be polar or not polar, right? So if you divide the bonds, you divide it in ionic and covalent. Now, the covalent are going to be divided in polar and no polar. Covalent polar is the water. Covalent no polar is going to be for example, fat. Okay, so again, if the covalent polar is hydrophilic because they love water, and the covalent is going to be hydrophobic. Hydrophobic. Okay, covalent no polar is going to be hydrophobic. Okay. All right, so here the pH. So I'm not going to explain all the pH because we already know about that. First of all, the pH of the blood 735, 745. And what I want just to take about this part is the pH in the blood is so important in that range. Why? Because we are going to find different enzymes. Enzymes, as you remember, is going to accelerate chemical reactions, right? If we don't have these enzymes, the chemical reactions are not going to happen. What are chemical reactions? For everything we do, right? For create proteins, for digest proteins or digest carbohydrates or lipids. So everything needs an enzyme. If we don't have the enzyme, what is going to happen? Well, it's going to take forever, days, in order to complete one simple chemical reaction when we have, every second, we have about 10,000 chemical reactions happening simultaneously in the body. So just to make a conclusion about this, the enzymes and the pH. What is the relationship between enzymes and pH? Well, let me tell you, the enzymes are going to work basically the majority in neutral pH. What is neutral pH? It's a pH that is closer to 7. Okay? And these enzymes in that environment or close to 7 are going to work. If they have a pH that is too alkaline or too acid, the enzymes are not going to be able to work, at least the majority of them. So what does it mean? If you have, for example, acidosis or alkalosis, can be respiratory or metabolic, the enzymes, one of the things is not going to work. So you cannot obtain actually energy efficiently, for example, right? So remember, in few words, enzymes mostly work in neutral environment. All right, so about the carbohydrates, the only thing I would like really, first of all, you need to remember all what is monosaccharides and the disaccharides. That is a must because it's general information that you must handle all the time during your career. But here, what I really want to remark is the polysaccharides. Polysaccharides are monosaccharides together, thousands and thousands, uh, dozens, and let's put it this way, dozens and dozens of monosaccharides together can lead into polysaccharides. And that is the starch. The starch we find in the bread, right? Cellulose, where we find we find this in the plants. Okay, let me see here just a moment. Okay, we have the cellulose that is the plants, right? Plants are going to be the plants. The starch is going to be the flour, right, that we eat in the bread. We have amylose and we have glycogen, and these two are actually confused for many students. Cellulose is the vegetables, the salad that we eat. Later on, they are going to become fiber, right? Fiber. They go to the colon, they go to the flora, forming vitamin K. All right. So glycogen. Glycogen is not fat. Please, it's not fat. So glycogen is a polysaccharide. It's a polysaccharide. And this glycogen is going to, as you can tell, accumulate about 2 pounds average. And each pound is going to accumulate 4 pounds of water. So total is going to be 8 pounds of water. Total 2 pounds. So total glycogen is going to carry about 10 pounds of your weight. Okay, so let's keep going. So this is about lecture 1. Let me just finish this. And let's go to lecture 2. Okay, I have it open already. And And I go a little bit more faster here in the lecture 1 or 2 because I want to give more time for the rest of the of the of the review. Okay. All right. So now here we need to remember we are talking about what? We are talking about the tissue classification, right? Tissue classification is how many tissues we have. 1, 2, 3, 4, right? Epithelial tissue. The one I want you to remember is what? The pseudostratified, pseudostratified, pseudostratified epithelium, right? And the pseudostratified epithelium, remember, are going to be cells who contain a nucleus here, and they are going to have a cilia, right? A cilia, and they are going to have another cell that with a big nucleus is called the goblet cell, the goblet cell. These goblet cells are going to form mucus, right? And that where is located the pseudostratified in the respiratory tract. Okay, so we already explained the mucus and the cilia. These are the barrier against bacteria. You have this in your trachea, in your bronchi, in your nose, and they are going to, when the bacteria is arriving here, go into a swamp that is literally the mucus. Well, not literally, it's a mucus, and this bacteria is going to not able to move forward. Plus, the cilia is sweeping out like a broom towards the outside of the body. So that is epithelial tissue, epithelial tissue, epithelial tissue. Another thing that I want you to remember about epithelial tissue is the epithelial tissue, the glands, all the glandular tissue. Glandular tissue, what is that? Gland is exocrine and endocrine. So all glands are coming from epithelium, right? Now, epithelium, this is one, pseudostratified, second, the glands, and third, what I want you to remember the definition. What is epithelium? Everything that covers hollow organs and everything that covers outside in the body. So, for example, the skin, right? Around the stomach and the lining of the stomach, the esophagus, etc. So that is epithelium. In connective tissue, what I want you to remember is three things, right? Connective tissue, what is doing? Connecting, right? And this connective tissue, we have three of them. Number one, or let's put A, is going to be the circulating, remember the circulating connective tissue, that is the blood, right? Blood, and don't forget about the plasma, right? Number B, or letter B, on connective tissue is going to be the, let's put C first, is the structural. Structural is going to be bones and cartilage, correct? All right, so why I put B at the end? Because it's in between. If this is fluid, this is solid, this is going to be in between. And that is the generalized, what I call lift, right? Lift. Why generalized lift? Because generalized connective tissue is ligaments, fat, and the tendons. So the word that I'm using is lift, general lift. Okay, so that is about the connective tissue. About muscles. Muscles, how many, so please, I saw that the students are confused. When I ask how many tissues we have, they make a collage of many things. So how many tissues we have? 4. How many type of muscles we have? Are going to be 3. Are the smooth, the striate, and the cardiac. And that's why we are going to make some mentions today. Okay, so that is about the muscles, 3 muscles, 3 group of muscles. Striate, it is the voluntary. Okay, striate is the voluntary. The smooth is the involuntary, and the cardiac muscle is involuntary too. And we are going to see the difference between them because it's important to remember that. And why is it important? Because that is making you understand, for example, in the heart, how is the electrical impulse happening during the systole diastole contraction of the heart. And the nervous system. The nervous system, we have the nerves, the neurons, and another cells that are going to be called the neuroglia, 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 neuroglia. The nerves, so we are going to write down again, please, nerves or neurons, and the other one is the neuroglia. Neuroglia. Neuroglia, what are neuroglia? Nerve cells too, but the difference is that these nerves that we have, for example, nerves that make the conduction or they make orders like the gray matter and the white matter, in the neuroglia, these cells are going to be like the helpers that are going to protect the nerves. Why? Because between the nerve and the artery, this is an artery, between the nerve and the artery, there is a neuroglia. This neuroglia is going to filter all the nutrients and oxygen coming from the artery and pass it to the nerve. So it's going to be as protection, neuroglia. Okay? All right, so let's keep going. So we're talking about here the pseudostratify. If you remember here, we was talking about the pseudostratify. And where is my pen? Okay, so the pseudostratify. So can you see the cilia there? That is the respiratory tract. Respiratory tract. Very important to remember. The respiratory tract. All right, so here we have the pleura. So we have the membranes. Remember the membranes? Those are membranes we call serous membranes that are epithelium. Where is the epithelium? This is the pleura. The pleura, the peritoneum, and the pericardium. Pericardium are, they have all of them, each of them, they have double layer. And the outer layer is the parietal, and the inner layer is the visceral. Please, visceral. Viscera means organ, okay? Viscera means organ. Viscera means organ. Okay, so here we have the view. We have the two layers. We have the parietal here, and we have the visceral because it's closer to the lung. And in between these two layers, we have fluid. Between the two layers, we have fluid. And this fluid is to decrease the friction, because imagine, can you see the lungs expand and contract, right? And the heart the same, right? Okay. All right, so let's keep going. Here we have the goblet cells. Where are located the goblet cells? In the simple columnar epithelium. So that is in the pseudostratify space, stratify. They can be in other parts, like in the intestine, but definitely is more, we use more about the concept when we are talking about respiratory problems. We are going to always think about the goblet cells, right? All right. Okay, so the glands. So first of all, the glands, what kind of epithelium are those? So how many group of tissues we have? We have 1, 2, 3, 4, right? Epithelial, we have the muscle, we have connective, and we have the nervous system, right? So this epithelium, under this epithelium, we have the glands. So don't ever forget this. Glands are coming from epithelial tissue. How many tissues we have? Four tissues, period. Okay? And the glands, what kind of tissue are? They are epithelial tissue. Exocrine and endocrine. Okay? Exocrine, they have a duct, right? They have a duct. This is the gland, and they have actually a duct that is going to drain out the fluid. Meantime, the endocrine gland, we don't have those ducts. So we have actually, for example, the thyroid gland. So again, to review here, circulating is the blood and lymph, and plasma, of course, generalized connective tissue, tendons, ligament, fat, and tendons. Structural, we have the cartilage and bones. Okay, very high yield here, please. 3 stars. We have the chondrocytes. What are the chondrocytes and why we need to know about chondrocytes? chondrocytes, chondro means cartilage, right? And cytes means what? Cell. So mostly at the beginning of life, about 8 weeks of gestation, the baby starts to form the bones. At 9 weeks are going to start forming the muscles. But at 8 weeks, that means 2 months after you get pregnant, you have the matrix for bones. For example, you have this area where it's going to be the future bone, and what we have is this material is mostly cartilage. This cartilage then is going to arrive whom? Is going to be the osteoblast. Is going to arrive the osteoclast. And you know the osteoblast is a young osteoblast is going to transform, change name into osteocyte. Okay? These cells are coming from the red bone marrow, that is another story. So we have a cartilage here, and what is going to the osteoblast is going to start deposit calcium. And this calcium osteoblasts are going to make the cartilage, that is the frame at the beginning, are going to turn into bone at the end, bone. So chondrocytes are those cells that are going to produce cartilage. Okay, so we have the type of cells. We have the osteoblast, we have the osteoclast. Osteoblast turns into osteocyte. Okay, so here we are going to do a small shortcut here. We have the nervous tissue, we have again the neuroglia, all the cells of support. So here for example, we have the nerve. Again, let's make it very quick. The nerve, this is the neuron, and the other group is going to be the neuroglia. Neuroglia is like a small monsters like this. They have projections to the nerve. And here we have the vessel, the vessel. So this guy is neuroglia, and this is the neuron. So this neuron needs oxygen and nutrients. So where is the blood? The blood is coming here. That is going to be oxygen and nutrients. So this neuroglia is going to project and filter all the nutrients. And when the nutrients, they pass the custom, let's put it that way, they're going to send it just to the nerve. So that is actually, the function is to support and protect the nerve cell. Schwann cells, please. Schwann cells are these cells that you have here. You see here. Those are the axon, covering the axon. They contain myelin. Important. The Schwann cells are going to be in the peripheral nervous system. Schwann cells. So Schwann cells are cells that produce myelin, and these cells are called in the peripheral, located in the peripheral nervous system, is going to be Schwann cells. But the cells who produce myelin in the central nervous system is going to be called the oligodendrocyte. So it's the oligodendrocyte who are in the central nervous system, and the Schwann cells are located in the peripheral nervous system. What they are doing? The same. They are producing myelin. Okay, and they are going to be located around the around the axon. Okay, so here I have another example here. Just a moment, very fast. Here we have the astrocyte, that is a neuroglia. This is a neuroglia. This cell is a neuroglia, and this is the neuron. This is the capillary or artery. If you can see, it's in between in between the capillary and the neuron. There is the neuroglia that is giving support to the cell, etc. Right. So part of the neuron, we have here the body, the nucleus. We have the myelin. We have the terminal axon, and here is the dendrites. So when they look at this, the electrical impulse is coming this way. That is called action potential. By the way, action potential, you're going to probably see in one of the action potential. It's action potential. Potential is the same to say electrical impulse. Just to make it simple, and actually it's totally right. Electrical impulse. Okay, action potential and electrical impulse. And these Schwann cells, this myelin is going to make the electrical impulse going in the saltatory way, saltatory Y here. So they're going to jump. From here, they don't go this way, they go this way, up, up, jumping, jumping, jumping. That is making the electrical impulse more faster. So here we have the terminal axon that is not, these are not dendrites. These are terminal axon. And this terminal axon is going to connect to the dendrites of the next neuron. For example, here we have the dendrites. The previous nerve cell are going to end as the terminal axon. Terminal axon connect to the dendrites. Then the dendrites go to the body, go to the axon, terminal axon, they go to the dendrites again. So axon to dendrite, axon to dendrite. That is how the nerve cells are going to communicate. Okay. Just remember we have epithelium is all cancers that are epithelium are going to, coming from epithelium, are going to be carcinomas. And all cancers from the connective tissue are going to be called sarcomas. Sarcomas. And sarcomas are much more aggressive than the epithelial tissue, carcinomas. Okay. All right, so let's keep going. So one thing I want you to remember is the biopsy. So when you are going to make diagnosis of a cancer, the final diagnosis is going to be the biopsy. The biopsy, they go to the laboratory, to the laboratory to see in the microscope, and they are going to categorize and classify what is the problem there. Okay, so in conclusion, we don't do any diagnosis of cancer with MRI, CT scan, ultrasound. Why? Because they are going to just, especially CT scan, are going to be used for staging of cancer. But the diagnosis, never forget, is by biopsy. Okay. All right. So talking about the cells, we just going to keep going with our highlights. So this is something you must know. We have the organelle that is the powerhouse. We call the powerhouse is the mitochondria. So remember, we have the cell, we have the nucleus, we have the mitochondria here, the mitochondria. So glucose is getting inside. Glucose is going to be in the cytoplasma, the glycolysis. Then they produce acetyl-CoA, and the acetyl-CoA enter into the mitochondria, and that produce the Krebs cycle and produce ATPs. Okay. All right. So just remember that. One thing about the proteins is the proteins. They love water. Okay, so whatever proteins, and who else love water is the sodium. Sodium love water too. Okay, so sodium is going to, wherever sodium goes, the water is going to follow. Wherever proteins goes, the water is going to follow the protein. So this is very important because in pathophysiology and later in med-surg you're going to need that. Okay. You already know very well transcription and translation. Transcription happen in the nucleus, translation happen in the cytoplasma. First is transcription with C, and translation is second with L. Right? Just simple to remember. All right, so you remember one thing here, we have the cell division. Cell division, what is important is where is happening the meiosis? The meiosis is happening in sex cells. So that is going to be happening in the testes, and it's going to happen in the ovaries, testes and ovaries, meiosis. In the rest of your body, it's going to be mitosis. If you have an injury, you have a broken bone, if you have whatever lesion in your system, besides the genitals or the testicles and ovaries, that is going to regenerate with mitosis. And mitosis is, we differentiate somatic. Somatic is the rest of the body, and sex cells are the cells in the gonads. Gonads. Remember gonads? Gonads are testicle or ovaries, right? All right. So let's keep going. We have the transportation. We have the passive. So we are going to stick with this a little bit. Diffusion, simple diffusion is gas exchange. Gas exchange. What means gas exchange? Oxygen and carbon dioxide, period. Facilitate is the entry of glucose in the cell. So when the glucose enter in the cell, period. Another one. Osmosis, where it happens in osmosis. Osmosis is a semi-permeable membrane, and this semi-permeable membrane is every single cell of your body. So that semi-permeable membrane were located in every single cell of your body. So every single cell of your body is going to produce, it's going to happen osmosis. Okay, so that is the passive, no energy. Active, we use energy, protein pump. This is extremely important. The protein pump, for example, we are talking about the sodium-potassium pump. Sodium-potassium pump. Okay, so please, I want you to remember this. Why? Remember this graphic. We have here remember this graphic? All right, so what is enter first is the sodium, right? And then the calcium. So anything that is mostly for sodium-potassium. So here is going to enter sodium and is going to go out potassium. So that is the sodium-potassium pump. Without that, the muscles and the nervous system are not going to work properly or not at all. Okay? All right, so that is, we are going to talk about fluid. Fluid, what I want to remark here is about the isotonic. All the substance that we put in IV mostly are going to be isotonic. For example, the 5% 5% dextrose in water. That is what we call dextrose in water. So that is isotonic. We have 0.9% of sodium chloride. Sodium chloride is going to be isotonic. You cannot only just in some very specific indications you can put something else, but definitely isotonic is the majority of it. Okay. All right. So let's keep going. Let's go to lecture number 3. All right, so here we are going to start doing this. So I'm going to want to have your full attention, please. So, okay, just a moment. Any questions so far? Any questions so far? Let me see. I cannot unmute. Okay, before we start the third. Okay. Okay, so I cannot. Okay, I see Saida is coming here. Hello, Saida. Hello, we have Rose. Thank you for coming, Naomi. There's actually coming. Thank you so much. So if there is no any question, just let me know or raise your hand, and we are going to continue. Okay. All right. So let's start. Lecture number 3. We are going to talk about the skin and health diseases and muscular system. Obviously, the big topic here is the muscular system, but we need to remember about the skin. The skin are going to go into some picture here. Let me see something that is going to be there you are. So here we have a summary. What you need to remember about the skin is everything that we talking, right? So the difference of the skin between parts of your body, the difference of the skin according to the age. So there is, and what is the clinical implications about the how thick or how thin is going to be the skin. So let me go here, please, in color. Okay, there you are. So the functions of the skin, number one, is what we need to remember, are four major functions. Protection against infection, because it's a barrier, right? Protection against dehydration. That is not going to allow enter water from outside to the body or going out. So prevent dehydration. Regulation of the body temperature, because the skin is where we are going to evaporate the heat. So that means that if you sweating, the water is going to evaporate, and this evaporation is taking heat from your body. So that is how the skin controls the temperature. And the collection of sensory system. All right, so let's keep going. The skin, oh, by the way, I want the picture. Here we have the skin, and the skin we have here is this is the epidermis. Look at this. Epidermis is going to have these all layers. All this is the epidermis. All this is the epidermis. And below that we have the dermis. The dermis. The epidermis is what we have is the melanocytes. 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 The melanocytes. They contain the melanin. And here in the outer layers is the dead tissue, right? Or dead cell, sorry. They are going to be called the cornea. Cornea. Sorry for the yellow. It's going to cornea. Corneus or stratum corneum. That is the outer layer of the skin. So everything else is located in the dermis. So we have the glands. We have another type of, this is sweat glands, for example. This is the, these are sebaceous glands, for example. We have another sweat glands here, another type. This is apocrine, the one who gives some kind of a smell if you don't wash it for long periods of time. Erector pili is a muscle. So we have arteries, we have veins, arteries, veins. We have nerves. Where is the nerve? All right, so there's no graphically nerve. We have nerve, we have muscle. Everything is in the dermis. Okay, so we already talked about let's talk about the nines, right? So the nines, we have 9, please, I want you to remember, 9 is all head. It's not only anterior, posterior. It's all the head. If you're talking about posterior and anterior, it's going to be 4.5 plus 4.5. So that is the whole head. One head is going to do one arm, and the same. Arms are going to be 9, 9, 9. 9, 9, 9. So head, arms, upper extremities are going to be 9. Then the lower extremities is going to be the double of the upper extremities, 18 and 18. So if you, this is the whole lower extremity, the whole thing, everything, all the lower extremities include 18%. But if you want to talk anterior posterior, is going to be 9% plus 9%. Now we have the trunk. The trunk is the biggest part of the body. That is important because here, if the injuries of burnings happen in this area, this is the area of highest, the biggest area. So that is where it's going to happen for loss of a lot of temperature. So because people who are burned, they can have a complication that is the hypothermia. Why? Because the skin is not there anymore. And the skin, it depends on the percentage, the heat is going to escape, so the patient can lead into hypothermia. And the genital area or perineal area is going to be 1%. Okay? All right, some terminology. Dermatitis is mostly you need to remember. Dermatosis is a term that whatever happened in the pathology in the skin is called dermatosis. Okay. Okay, let's talk about the muscular system. And the muscular system, we need to yield a few things here. You need to know the difference between the smooth, straight, and cardiac muscle. How many, don't get confused anymore. How many tissues we have in the body? We have 4. muscle, nerves, epithelium, and connective tissue. The muscle, in this case, how many types of muscles do we have? We have three types: smooth, striate, and cardiac. Smooth or involuntary. Smooth or involuntary. I'm doing a color just a moment. Is involuntary. The striate is the voluntary, and the cardiac is involuntary too. So the smooth is going to have this. Is going to have. Oh, sorry. Is going to have this single nucleus. Single nucleus. The smooth, single nucleus. Single nucleus. Cardiac is going to be single nucleus. Single nucleus. Single nucleus. Now, the striate is multiple, so that is the difference. Striate is voluntary, smooth involuntary, and cardiac involuntary. The other thing we need to remember is the intercalate discs, where they belong to the cardiac cell. So we have this very thick ending of the one cell of the heart is going to be the nucleus, central nucleus here. And here we have these kind of bands that are going to be on the extremes of the cell. That is going to be, for example, another cell here, another cell that is going to make tight, very like we call syncytial. So that means that everybody work so close to each other, and that is the intercalate disc. At the same time, they are going to transmit the electrical impulse faster. Okay, so here again we need to remember the well, you asking me, there are some pictures, probably yes, probably no, I cannot say, but definitely you must know the this is the muscle fiber. Muscle fiber, right? Muscle fiber is the same to say one cell of the muscle. One cell of the muscle is the muscle fiber. Okay, muscle fiber. Okay, so this is going to be covered by endomysium. Each muscle fiber, the group of fibers that each of one are going to be covered by endomysium. All this group are going to cover by another membrane that is called the perimysium. Perimysium. And the group of all the fascicles around is going to form, are going to be covered by the epimysium. And all together are going, the projection of endomysium, perimysium, and epimysium are going to be projected through the tendon to attach to the bone. All right, so let's keep going to the few things we need to remember here. Just a moment. Oh, okay. Just a moment. All right, so let's talk about the muscle contraction. Okay, talking about the muscle contraction, please, I want you to observe, just helping me here. I cannot wait longer. Hopefully it's going to be fast. Please just give me a few seconds. Hopefully it's going to work this. Okay, unfortunately the video is not coming up faster, so I'm going to skip it. Okay, so I'm going to just do manually. Muscle contraction, okay, it's impossible. Okay, all right, so here, what we are going to do is this. Here we have the myosin and actin. So proteins that we have in the muscles are going to be the actin and the myosin, right? Actin and myosin. So let me see here. Okay, so here we have the actin and the myosin. These actin and myosin are the ones who actin myosin are the I'm trying to do something here. Yes, the one. Okay, so here we have the actin and the myosin. Actin and myosin. Actin and myosin are the one who interact each other, right? So in order to make that contraction. So these are blocked by whom? By the troponin. Troponin is blocked. It's blocking the actin and the myosin. So if you see here, we have the troponin. We have the troponin. This is the troponin here. Can you see the troponin in yellow? This troponin is going to, here we have the myosin. Can you see the myosin here? Can you see this bluish, greenish, whatever is going to be the actin? We have the actin, and the troponin. So we have basically myosin, actin, and troponin. So if you see the troponin is locking the action between the myosin and the actin. So that not allowing the contraction of the muscle. So what is going to come is the calcium. Calcium is coming in order to take the troponin out from this link and release the actin and the myosin in order to contract. So who is stopping this contraction? The troponin. We need to get rid of the troponin in order to have contraction. For this is coming calcium. Calcium where is coming from the sarcoplasmatic reticulum. This area, this kind of bluish here, is where we have a lot of calcium. That is where is coming the calcium. And the calcium are going to be released. Why? Because there is going to be a depolarization. Depolarization means the entry of sodium into the T-tubules. So the T-tubules are going to transport the electrical impulse of the sodium. Here is the depolarization, and the sodium interact with this sarcoplasmatic reticulum to release calcium. So this calcium go to the troponin and release the actin myosin. Important too is to remember that who is going to make the sodium enter into the cell. Who is the one who is making the sodium enter to the cell? And that is the acetylcholine. Can you see the acetylcholine here? Is the acetylcholine. The acetylcholine. Acetylcholine is going to produce the entry of sodium into the cell. The sodium into the cell release calcium, and the calcium take out the troponin to release the actin and myosin to produce that contraction. Again, here we are going to have the acetylcholine. So we have giant cat, if you remember. We have G is nothing. I is the electrical impulse. Is the electrical impulse. Is the electrical impulse. Electrical impulse. We have then is going to release the acetylcholine. A. IA. Then N is the entry of sodium. Giant. Right? And T is the T tubules. Cat is going to be calcium. T of the cat is going to be the troponin, right? So that's what we call the giant cat. Easy to remember. So now I want to go even further than this. Number one, here we have what that is. This is the transition between the nerve. This is a nerve, and this is the muscle. That is called the NMJ. Is the transition between the muscle and the nerve. Is the neuromuscular junction. The neuromuscular junction. So this is actually a terminal axon. What you see here is the terminal axon. This terminal axon, what is having inside is the acetylcholine. Electrical impulse, the electrical impulse, as the electricity is passing one and again, they are going to make release the acetylcholine into this neuromuscular junction and produce the acetylcholine, produce the entry of sodium and all what we just mentioned. All right, so more than that. So we are prepared to know this. So we have acetylcholine. Who release acetylcholine? Remember the peripheral nervous system is going to be the somatic, and is going to be the autonomic, right? And the autonomic is going to be two things. We have the sympathetic and the parasympathetic. So who release acetylcholine? Acetylcholine are going to release by the postganglionic parasympathetic, and from the somatic nerve. The somatic nerve is called the motor neuron. Motor neuron. Remember when we was talking about the efferent and the efferent? All right, so that is the somatic peripheral nervous system. So everything that is skeletal muscle, your muscles that you can move as you will, as you want. So that is the somatic. Acetylcholine, contraction. Then we have the parasympathetic. We have the involuntary muscle. Remember, somatic is the voluntary, and the parasympathetic is part of autonomic, means involuntary muscle. So that means that is all the gallbladder, the intestines, everything is going to use acetylcholine. So what is doing acetylcholine? Contraction. Okay, striate muscle, contraction, acetylcholine. Smooth muscle, contraction, acetylcholine. So that is where this is going to be applied in everything you are doing. And in addition to that, remember when we was doing this chart again, this chart, okay, so let me change because the ink is not helping me. Okay, so here we have, for example, this, remember this chart, okay? So sodium and calcium, remember? So sodium and calcium. See, sodium and calcium in this smooth muscle, striate muscle, cardiac muscle. So they need to enter sodium into the cell. See, that's what I said here, right? Sodium is entering into the cell. And the calcium is going to enter too in order to produce a contraction. This is going to happen in the cardiac muscle, in the striate muscle, and it's going to happen in the smooth muscle. All right, so let's keep going. Okay, so let's keep trying to. All right, so let's keep going. So it's about the muscles that we was talking already. So let's talk about some high yield of the muscles, please. This is very important. I really want to just mention what is important here. First of all, we have the orbicularis oculi. The orbicularis oculi. The orbicularis oculi is here around the eye. Can you see here around the eye? Orbicularis oculi. We have orbicularis oris. Orbicularis oris is around the mouth. Oris means mouth. We have the buccinator. Buccinator is the whistling. When you're whistling, that is the buccinator muscle. We have the mastication, masseter muscle. Where is the masseter muscle? This is the masseter muscle. So with this is a pontic muscle that is going to make chew and chew the food, right? Buccinator. So if you try to whistle, this muscle is going to contract and produce the whistle. Okay. Okay, masseter muscle. So all right. So we have muscles of the respiration. Another high GLT here, please. This is the diaphragm. Where is coming from the diaphragm? The diaphragm is coming, muscles are coming, the origin of the muscle coming from the ribs and from the spine. And they are going to have a tendon. A tendon here is in the center because the origin is from here, 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 and all together they are going to join together as a tendon in the center. This tendon is where it's going to pass the esophagus, the aorta, the IVC, etc. So, but what is important here is the main muscle is the main muscle of respiration is the diaphragm. The diaphragm. Okay, the diaphragm. So the most important. So we have two types: the expiration, and the inspiration. The inspiration, the most important, is the diaphragm. And for expiration is going to be the intercostal muscles, the ribs, right? When we go and eat ribs, those muscles that we eat, that is the intercostal muscle because it's muscle in between the ribs. That's why it's called intercostal muscle. All right, so we know that. We have the muscle here, the external oblique, the internal oblique, and the transversus abdominis, that is muscles of the abdomen. And why do we need to know that? Because if you have some surgery you need, or people who are being in disability, they cannot defecate, they are going to use, for example, the abdominal muscles to do that. And we can explain another time, but definitely that is the names that we need to remember. Transverse abdominis. Transverse abdominis is here, and you see here, transverse abdominis, internal oblique, external oblique, and the rectus abdominis, that is actually what we call the six packs, right? Okay, so this area you see here, this is the pubic area, here is the anal area. Here we have this area. I'm going to draw a triangle. Here. Okay, just a moment. We have here one point, here another point, another point, and another point, and another point. So we have a triangle, right? So if we divide it in two, we have one triangle here and another triangle here. This is the anterior perineum, and this is the posterior perineum. That is where you have all these structures. We have the, look at this, this is the clitoris, it's not the urethra. It's very important to know that. Why? Because if you don't know the anatomy, you are going to try to put a Foley catheter through this structure when they should go being in the urethra. Or sometimes they make a mistake and they put it in this area, the Foley catheter, when they should be here in the urethra, opening. Okay, so or some people you put it by mistake in other area like the anus, and that is not very uncommon. So why? Because you have patients who are very heavy, like 400 pounds, 350 pounds, and definitely it's difficult to visualize the area when you're going to do that. So it's not uncommon. All right, so the gastrocnemius muscle. So here we have the gastrocnemius muscle. Can you see this muscle? This is the calf. One gastrocnemius muscles and another gastrocnemius muscle. So we have two gastrocnemius muscles. And in between, what is running? A vein. If you see, when you walk, these muscles are going to contract. And in between what we have, a vein. So they are going to contract and squeeze the vein, making the blood going upwards. So that is what we call the second heart. Second heart. Who? The gastrocnemius muscles. The gastrocnemius muscles. They are going to end into the Achilles tendon, in the calcaneus. Okay, calcaneus is the bone of the tarsal bone. All right, so let's keep going. Okay. Let me close this. I'm sorry the videos didn't work. It's kind of, okay, let's go to lecture 4. Oh, so please pay attention to this. Let me see, what time is it? Okay, so we have 50 minutes. We are okay. Any questions so far? Everybody's there. Raise your hand if you need something. Or you can wait until the end, because I can close the webinar and we can still answer questions after that. It's up to you. All right, so let's start with chapter 7. We are skeleton and bones. Okay, so number 1, in every single thing you study for anatomy, you need to know what is the anatomy physiology. What is, first of all, describe the organ. In this case, it's the bone, and the function. So what for? What for do we need epithelial tissue? What for connective tissue? What for we have nervous system? So those questions that you always need to repeat it all the time. So here we have the components of a bone. We already talked about that. I'm not going to go into much detail, just a general review. Here we have the bone, is a long bone. Here we have epiphyses. How many epiphyses we have? 1, and another epiphysis 2. They are going to be on the extremes of the bone. In the center we have the diaphysis. In the diaphysis we have the medullary canal or medullary cavity, and we have here inside the yellow marrow. Here we have in the epiphysis, we have the red bone marrow. The red bone marrow, red bone marrow, is the one who produces the hematopoiesis. And the hematopoiesis is going to have three components: the erythropoiesis, the platelet production, and the white cell production. Okay, don't forget that the lymphocytes are white cells. Then we have the periosteum. You see here the periosteum is the membrane covering the bone. It's very attached to the bone, so it can look like it's part of the bone, but it's just a covering very tight to the bone. That is the periosteum. And here in this medullary canal, the lining, what is lining this cavity, is going to be called the endosteum. Endosteum and periosteum. Peripheral, outside, right? All right, so that is about. So let's see if we can find the. Here we have the osteon, right? The osteon is the what? Is the functional unit of the bone. Okay, it's like you have a brick, one brick. You can have thousands of bricks. You can make a wall, right? But and the same with the osteon. The osteon is like comparable to a brick, right? So these osteon have all the functions of the bone. Okay. All right. So we talk about the lamellae. Lamellae are these rings you see here. So at the beginning of formation of the bone, you are going to have this a vessel. It's the Harvesian canal that is the artery vein. From this are going to be this deposit of matrix um, done by the uh, uh, um, uh, done by the osteoblasts. And the osteoblasts are going to produce these matrix that are going to get harder, and because they cannot move anymore to any place, the osteoblasts, they're going to get trapped here in this lacunae. And when they get trapped, it's changed name, called now the osteocyte. And then the next ring is going to happen, and the next ring is going to happen the same way, and the next ring is going to happen in the same way until and the bone is growing in that way. Okay. All right. So we have here the osteon. We have the osteon. Can you see here? Where is the osteon? This is a cut of the bone. This is an osteon. One osteon, two osteums, three osteums, four osteums. If you see here, they have the lines. Those are the lamella. We have these dots, dark dots that are the lacunae, where is located the osteocyte. Okay, so here we have the same thing, right? So here we have the dark spots are the lacunae. What is inside is the osteocyte. Okay, so let me see if I'm more lucky today right now. Oh, okay. I'm sorry, I want to have a video here, but let me see if that is working. I'm sorry, unfortunately, the videos I was preparing for you today looks like they are not working. So, all right, so let's keep going. One more time. Okay, so that's fine. All right, so here we have, so what I want just you to remember is this is one. Look at this. These are the osteoblasts. Can you see the osteoblasts in blue? These osteoblasts are moving this way, are getting in this direction. It's coming like towards you. And this is the cartilage. And what they are doing, these guys are as more, they are moving. They are moving. This is like a cement. It's not solid yet. It's not solid yet. It's not solid yet. And these guys are going to keep moving over the cartilage, leaving this osteoid material. and then there is a moment that there is no space to move anymore because are surrounded by this material. And what happened, that is going to stay in the place. That's what create what? That is what is going to create this lamellae. So this space is where that osteoblast is being trapped. And another osteoblast trap. And they are going to be progressively adding more rings to the bone. One ring, two rings, three rings. So these osteoblasts trapped in the lacunae, these dark areas, are going to be called the osteocyte now. Okay. What is doing the osteoclasts? The osteoclasts are going to reabsorb bone from the tissue, from bone tissue. So then what is it going to mean? Osteoclast is going to take calcium from the bones. They're going to take calcium from the bones. Osteoclasts take calcium from the bones and put it into the blood system, in the blood circulation. Sorry. We have osteoblast that is doing the opposite that the osteoclast. Osteoblast is putting the calcium from blood into the bone. Osteoclast taking calcium from the bone to the blood. And osteocyte, what it's doing is the maintenance and repair of the bone. Okay, so here we are going to continue with that. So bones. In bones, we have the mandible. We need to remember that the cranial bones we have, first of all, with cranial bones we have one frontal bone, two parietal bones, two temporal bones, one ethmoidal, one sphenoidal, one occipital bone. So those are 8 bones. We have 14 cranial bones, the mandible, maxilla, we have 2 maxilla, right and left, the zygomatic, that is the cheekbone, the zygomatic. We have the anterior fontanelle. If this is anterior, this is posterior, right? This is frontal, in blue frontal, this blue occipital. So this is the parietal, this is from above, this is sagittal view. So here we have that the bones are not totally fused. These openings are called the anterior fontanelle. We have another ones, the sphenoid fontanelle, we have the mastoid fontanelle, we have the posterior fontanelle. The most common that we need to remember are two, the anterior and the posterior. Anterior close is the largest one, it's going to close in about a year, and the posterior in about 6 months. Okay, so we need to review about the ribs, the true ribs, the false ribs, and the floating ribs. Just remember everything posteriorly, dorsally are attached to the thoracic vertebrae. Anteriorly is variable because that's why this is going to change name. Ribs, true ribs, false ribs, and floating ribs. True ribs directly attach ribs to the sternum. False ribs indirectly attached to the sternum because they are attached through a cartilage. And the floating ribs are not attached at all to the sternum. Bones of the upper extremities, please you review. Just put your arms in anatomical position and try to tell me where is the radius, where is the ulna. So that is extremely important, basically very important. Okay, so all right, so osteomalacia and the effect of the bones is the osteomalacia is in adults. In children, it's called rickets. Okay, osteomalacia is in adults, and children is called rickets. We have another pathology. We have benign is osteoma, and malignant is called osteosarcoma. Sarcomas means the cancer of the connective tissue. Kyphosis, hunchback, lordosis, swayback, scoliosis, lateral curvature. We need to remember that green stick pediatric fracture is the most common in children. Another high yield topic, please. This we have the synarthrosis, the amphiarthrosis, and the diarthrosis. So, why I'm not saying this? Because the most common to call are synarthrosis, amphiarthrosis, and here is called diarthrosis or synovial. So those are the most common way to call these articulations. Diarthrosis is very wide range of movement, upper and lower extremities. Amphiarthrosis is not so much, not so little. So the pubic symphysis and the intervertebral cartilage, that means the column. When you bend forward or stretch out, the column is moving slightly. So that is amphiarthrosis. Synarthrosis is the sutures on the head that are not movable. All right, so talking about the nervous system, in the nervous system, what we need, this is our nemesis or whatever we want to call. All right, so let me put the pointer, and here we are going to see something else here. Okay, here we have the somatic. This is the somatic, and the somatic, no, somatic or voluntary. What is that? The somatic or voluntary is going to be all the, for example, skeletal muscle. Skeletal muscle. Skeletal muscle. Somatic, what they are going to do is, if you see the spine, this is the spine, and this is the cerebrum here, okay, cerebrum here. This is the spine. This is the central nervous system. All this is central nervous system, but what is coming out is peripheral nervous system. Peripheral nervous system, whatever I'm drawing now. Right? And this somatic are going to innervate your biceps, all the muscles you can move. And that nerve is called the motor neuron. Motor neuron. Motor neuron nerve. And this motor neuron nerve is going to be the efferent, remember, and the efferent. Remember when we was hitting our hands and then having pain and then come back with information, that is the somatic nervous system. And the autonomic involuntary is going to be divided in the sympathetic and the parasympathetic nervous system, right? All right, so let me see some graphics probably is going to help us. All right, so here we have the type of neurons. We already talked about the myelinated and non-myelinated in the previous one. We have the efferent. The efferent is the sensory. Efferent means that is coming to. Efferent with E means that is going away. And efferent means towards. Towards what? Towards the spine. Towards the spine. Away from where? From the spine. Okay? So now these are going to be the sensory, and this is the motor. And this is part of the somatic nervous system. The interneuron is going to be here. Let me see if I have a picture of the interneuron. I'm sure I have one. Where is the interneuron? No, interneuron. Okay. All right, so for this I'm going to spend a little bit time drawing something that is going to be helpful for us, I guess. Just a moment, I'm going to create another page. Okay, I'm going to go a little bit slow in here, and we are going to talk about the sympathetic and the parasympathetic, okay? All right, so it's going to take me 10 minutes, no more. Okay, so let's draw the brain. I'm sorry for my drawing. Okay, the brain. And here we are going to have the spinal cord. Okay, okay, whatever. Okay, so here's the spinal cord, right? So this is the brain. So now here all this what I just draw is the central nervous system. Is the central nervous system. In the central nervous system we have in the central nervous system is going to start the peripheral nervous system. Where is the peripheral nervous system? Is everything that is coming, from the central nervous system. This, for example, here, or this here, okay? And let's put another line here and another line here, okay? It's about the at the level of L2, where we don't care about that. Okay, so the peripheral nervous system is divided in the parasympathetic. This is parasympathetic. Okay, there is one nerve, another nerve, another nerve, and another nerve. So those are parasympathetic. So these are parasympathetic. Parasympathetic. So what happened here is that we have nerves coming from the cortex, go to the diencephalon, and the nerves are going to come here. So remember that we have the one neuron going into the terminal axon, and then this neuron is going to communicate with another neuron through the dendrites, right? Dendrites. And this terminal axon, dendrites. Terminal axon, dendrites. Terminal axon, dendrites. So that is how it's happening. Terminal axon, dendrites. They are going to communicate all the way down. So one of these cells are coming out. So we have one cell here, one cell, and this cell is going to send the axon, terminal axon, dendrites, terminal axon, dendrites, and they are going to get into a group of what we call the ganglion. Ganglion. This ganglion, what is a ganglion? We have thousands and thousands in each line. It's like a wire of a telephone. They are going to have thousands and thousands of these are coming to form a ganglion. And here, in this ganglion, we found another nerve this is the terminal axon, and is going to find the dendrites of a nerve in the ganglion. This ganglion is going to be located in the target organ. Target organ. Okay, again. So we have here, we have the nerve coming from the parasympathetic. Okay, and here's the ganglion. I'm going to make the ganglion, and here is going to be the target organ. For example, we have the wall of the intestine. The wall of the intestine. The wall of the intestine, these ganglions are located inside the wall of the intestine. Parasympathetic, remember, rest and digest. Rest and digest. Parasympathetic, rest and digest. Okay, so this area before to reach the ganglion is called the preganglionic. Preganglionic. And this small nerve here is going to be the postganglionic. So we have preganglionic and we have postganglionic in the parasympathetic. The preganglionic, they are going to, by electrical impulse, they are going to release what? Acetylcholine. Acetylcholine. The other postganglionic or the parasympathetic is going to release acetylcholine. Acetylcholine. So everybody releases acetylcholine. And what is doing acetylcholine? Remember giant cat, muscle contraction. Acetylcholine makes sodium enter to the cell, calcium, troponin, etc., etc. So that is what is doing the acetylcholine. And the acetylcholine is not going to do that only just in the striated muscle, but the smooth muscle too. And in the nervous system to produce what? Electricity, the electrical impulse. Okay? All right, so then we have the sympathetic. The sympathetic is all this area. This is the sympathetic. Sympathetic. These sympathetic are going to have a short, is going to have a short pathway, a short preganglionic. And here's the ganglion, and we have a long postganglionic. Okay? So just remember that preganglionic, parasympathetic is longer. Parasympathetic is longer, right? Sympathetic is shorter. Okay, so these ganglions here is going to release what? All these guys are going to release acetylcholine, ACH, acetylcholine. All these ganglions are going to release acetylcholine. So everybody is doing acetylcholine. But the difference here is the postganglionic sympathetic. Postganglionic sympathetic is going to release adrenaline, 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 adrenaline. Okay? Okay. So that is about, so you know that the acetylcholine is going to look for cholinergic receptors. Cholinergic receptors. And what are these cholinergic receptors? Are going to be the acetylcholine, receptor for acetylcholine. This receptor for acetylcholine, what is going to do? Please remember this: contraction, contraction, contraction. You give acetylcholine to somebody and, for example, the urinary bladder is going to contract, it's going to pee, right? If you give acetylcholine to a patient, it's going to increase the peristalsis, the contraction of the intestine, okay? Rest and digest, so mostly related to the GI tract. And the sympathetic is going to be the alpha 1, the sympathetic is adrenergic receptor, alpha 2, beta 1, and beta 2. Alpha 1, vasoconstriction, alpha 2, vasodilation, beta 1 is going to increase the heart rate of the heart, and beta 2 is going to produce bronchodilation, bronchodilation, okay? Remember, this is a review, right? All right, so another important thing that we have is that this is what happened in the ganglion. What happened in the ganglion. Look at this. If we see here the nerve, this is the spine again, and this is the nerve, and we already talked that this is a ganglion. Let's make a ganglion, big ganglion here. In this ganglion, what is going to do, this terminal axon is going to end like this. And here we have another nerve that is going to continue as a postganglionic. This is preganglionic, and this is postganglionic. So here is, for example, one example of synapses. Here in the ganglion, in order to connect, they are going to connect to the dendrites, correct? So this is an axon. Can you see the axon here? This is the axon. Can you see the dendrite? This is the dendrite. These are the dendrites. So what happened? We have the presynaptic. Don't get confused with the preganglionic. Preganglion is everything that is before the ganglion. This is another what we describe the connection between cell nerve to nerve. Okay, ganglion is the collection of nerves, and synapses is the connection between nerve to nerve. So here we have the acetylcholine. Acetylcholine is going to be, this is the presynaptic. If everything is synapses, this is presynaptic, and this is postsynaptic. And this is the synaptic gap. That is the synaptic gap. Always there is space. So acetylcholine is released to the synaptic gap and passed to the dendrite of the next nerve. All right, so that is about. Let's keep going. Oh. No neurotransmitters. Oh. Okay, let me see if this works. Okay, so this is about finally one sympathetic nervous system is going to what happened. The patient, the person gets scared. So all what is making you think about the sympathetic nervous system, what is making you increase your adrenaline levels, right? So you are thinking about the problem. The problem is connected to the brain. They go to the diencephalon, and they can go to the brain stem. So all the problems are going there. They are going to go and where? Look at this. What is doing? They are going to go to the sympathetic nervous system. And remember, the sympathetic nervous system, we have we have the adrenal gland. Remember the adrenal gland? The adrenal gland are going to have the cortex, and here we have the medulla. The medulla. This medulla is the one who produces epinephrine, right? Adrenaline, epinephrine, norepinephrine, etc. So epinephrine. So what happened here is this medulla is connected to whom? It's going to be connected with this, what produce? Adrenaline, right? So what nerve is going to be here? Is the post-ganglionic sympathetic. That is where it's coming from, the adrenaline in our body. That is where it's coming from, the adrenaline in our body. Okay? All right. So that is about the sympathetic nervous system. So the dilate pupils, right? So you got more salivation, right? So the heart start to beat faster. Your lungs start to have bronchodilation. Your arms have vasodilation for more blood. So that is the fight or flight, adrenaline. Okay? Okay, let me see. All right, so here we have, again, we have the sympathetic, okay, and the parasympathetic. If you see here, this is the ganglion. This is the ganglion, and this is the ganglion. Sympathetic ganglion, parasympathetic. The preganglionic is going to be longer in the parasympathetic, and the sympathetic, the preganglionic is going to be shorter. So what they release here, look at this. They release in the parasympathetic acetylcholine, and the postganglionic acetylcholine. And the sympathetic is going to release in the preganglionic acetylcholine. But in the postganglionic is going to produce adrenaline or noradrenaline. Those adrenaline, noradrenaline is going to affect whom? The alpha receptor, the adrenergic receptors, alpha, beta receptors. Okay? All right. So here's the interneuron. That is, I was missing that. The interneuron, you see here. Interneuron is the reflex. So you know that this is the sensory, that is the efferent, right? Let me go here. That is the efferent. This is the efferent. And the one who is the motor nerve is the efferent, or motor nerve. Motor nerve. So that is the somatic. That is the somatic. And what is going to release here? It's going to release, you said very well, the acetylcholine. Acetylcholine. Interneuron, so when you have the pain go here to the same level of the medulla, and they go to the brain and go back, and they go to the efferent. But in the reflex, that is not going to happen. They are going to go the efferent, and they don't go to the brain. They go straight forward to the efferent without going to the brain, without making it conscious. So they are going to, this shortcut or bypass is going to be doing by the interneuron. All right. So let's keep moving to our last. I think. So we have 4. This is 4, right? Yes. Okay, so here we have some remarks that we need to do here is about the meninges. So let's see here. First of all, the division of the nervous system, right? Here we have very clear. Remember the orange and the pulp, right? The orange is going to be the cortex, and the pulp is the white matter, and these are the seeds, the diencephalon. Those are gray matter too. Gray matter are sinkers, right? Gray matter and cortex. Gray matter is the cortex. Gray matter is in the diencephalon too. Where is in the diencephalon? The thalamus. Thalamus, hypothalamus. Thalamus, hypothalamus. Below this, we have the brain stem, the midbrain, pons, and medulla. What we need to remember about this, the functions, right? The frontal is going to be motor, okay? It's going to be the cognitive, the consciousness, the thoughts, okay? The reasons, logical thoughts are going to be in the frontal hemispheres. We have the parietal hemispheres are going to be for sensorial. So all what you feel pain are going, all sensations or touching, that is going to be the parietal lobe. Then we have the occipital lobe. The occipital lobe is going to have the vision. We have the the temporal lobes are going to be for audition especially, right? Audition, for hearing, sorry, audition, hearing. Okay, so that is about the frontal, the cerebellum. What is that doing is the equilibrium, balance, and coordination, right? And the brain stem here is very important. Here is where we have the respiratory center, the cardiovascular center, and the vascular motor center. So that means that if you damage the medulla or pons, your respiratory center is going to be damaged. You not able to breathe anymore, or you have arrhythmias or heart arrest when you have, because this is the cardiorespiratory center of the system. So that is the vital signs, in other words, of the person are going to be in the brainstem. Okay, so we have the meninges. Meninges is the dura mater, arachnoids, and pia mater. So those are covering the central nervous system completely. When I said meninges cover the whole central nervous system, it means covering the brain and the spinal cord inside. Okay. This is a view of the this is part of the somatic nervous system, and what I want you to remember is in the medulla oblongata, can you see the nerves coming from the brain, going to innervate the muscles in the peripheral area? This information that is coming are going to have a crossover at the level of the medulla oblongata. Midbrain, pons, medulla oblongata. And this medulla oblongata is where you have the decussation, that means the crossover. So if you have pain on the right hand, the left hemisphere is the one who is going to detect. If you have pain on the left hand, the right hemisphere is going to detect, is the one who detects that. Okay. Again, gyrus, this circumambulation, we just talked why is that. We have the sulci, or sulcus, or singular, sulci, plural. All right, so that is about, we have the limbic system. The limbic system is emotional states, behavior involved in learning, long-term memory. Here, the medulla oblongata is going to have the respiratory center, cardiac center, vasomotor center, and the decussation. That means the crossover of the contralateral. The division of the cerebellum, we have the right cerebellum and the left cerebellum. Here we have the connection between them is the vermis. The connection between the hemispheres, the right and left hemisphere, is of the cerebrum is going to be called the corpus callosum. Corpus callosum. Corpus callosum. All right, so in the ventricular system, where we have the production of the CSF, the cerebral spinal fluid. That is actually produced by the choroid plexus. Let's make a look at the choroid plexus. Choroid plexus is here in the ventricular system. Those are cavities. And what is in this cavity? Fluid. What fluid? The CSF, the cerebral spinal fluid. The abnormal accumulation of CSF is going to be the hydrocephaly. Okay, so super favorites is going to be, number one is the olfactory, number two is going to be the ocular nerve, optic nerve, the optic nerve. This optic nerve are going to be for vision only. It's not for eye movement. The eye movements is going to be 346. We have the trigeminal. Who is the trigeminal? Is the oh, by the way, one, olfactory, smelling. Number two, the optic is going to be the vision. 346, we have the ocular motor nerve. We have the trochlear nerve, and we have the abducens nerve. All of these are going to make the movement of the eye. Number 5, we have 1, 2, 3, 4, 6. Where is number 5? 5 is here. Is that trigeminal? Trigeminal is three branches that go towards the face: the ophthalmic, the maxillary, and the mandibular. All these guys is going to produce the sensitivity of the face. So you close your eyes, pass your finger on your face, any part of your face. What you feel is being detected by the cranial nerve number 5. Here we have whom? A face is number 7. You can write down a 7 with a face with a 7. That is the facial nerve. What is the facial nerve number 7? And this facial nerve, what is doing what is the expression of the face. A smile, frown your forehead. And 8 is going to be the vestibulocochlear nerve. Vestibular cochlear nerve. Vestibular cochlear nerve. Okay, about the senses, we need to remember the 3 layers and the 3 chambers. Remember, vitamin A is going to influence on the rods, not in the cones. On the cones, okay. All right. So we have extrinsic and intrinsic muscles. Intrinsic is going to be the pupil. Remember, we was talking about. I'm going back here. Let me see if I see here the picture. Here we have the choroid. Sorry, it's called well, it's where it's formed the ciliary body. Sorry, the ciliary body. The ciliary body is going to have 3 components. The ciliary gland produce the aqueous humor. Remember, the anterior chamber is going to have aqueous humor in between the cornea and the iris, and we have the aqueous humor in between the iris and the ciliary muscles, or the lens. Sorry, is the iris. Between iris and the lens, we have the posterior chamber, and more behind, on the bottom of the eye, we have the vitreous body. All right, so that is about the ear. We need to remember about the components of the ear. Here, you remember here we have the outer. It's coming from the pinna to the tympanic membrane. The middle ear is going to be the ossicles. The ossicles, those are me's, the malleus, incus, and stapes. And there is a space coming going to the pharynx that is called the eustachian tube, and that's the whole thing of the middle ear. The inner ear is going to be the vestibular area, the cochlea, and the semicircular canals. So here's the cranial nerve number 8. Why is called vestibulocochlear? Vestibular cochlear nerve. So this is the nerve. So that's why it's called that. Okay. What is the? If you remember, what are the structures or the structures that produce? What organs are going to change the mechanical vibration of the water with into electrical impulses? Is the corti organs. The corti organs. Corti organs. Okay. So let's go to our last lecture, and this is a review again. So I'm just highlighting at this moment whatever is important, I consider important, and let's go to the lecture number 6. Okay, so number 1, you need to remember what is positive and negative feedback. Positive feedback, you need more. Negative feedback, you need less. Okay, so here we have the glands, and one gland I want to mention here is the pineal gland. The pineal gland. Pineal gland is called the third eye. The third eye. The third eye is going to produce melatonin. Melatonin is going to appear only at night. So the night, when you appear the night, melatonin is going to appear and induce sleep. So that's simple as that. Okay. All right. So we have the negative positive feedback, as we mentioned. We have the names of the pituitary gland, please. Hypophysis, master gland. We have the pituitary gland. It's called anterior, the anterior adenohypophysis, and the posterior is the neurohypophysis. All right. Hypothalamus is nervous tissue. Pituitary gland is endocrine tissue, glandular tissue. So that is what we call the homeostasis. That is the relation between the nervous system and the endocrine system. Okay, hypothalamus, nerves, and here's endocrine system, gland. Okay. All right, so we have the different names that we was talking about, the GPTAL, remember the growth hormone, prolactin. We was talking about the ACTH, the FSH, LH, and the posterior lobe produce two hormones, the antidiuretic and the oxytocin. All right, so I think we already covered mostly in the previous class. Just remember the hypothyroidism. So one thing is important you to know is, again, the, let me see here, just to finish. The GPTAL, right? GPTAL. So you need to know the name of the gland, of the hormone. Second, you need to know the target organ. And then you just need to know the action. So from all these, how many hormones we have in the anterior pituitary gland? 6. How many hormones we have in the posterior pituitary gland? Posterior, the hypophysis is 2. And that is what actually need you to be very, you need to be easy to recall, okay? One thing here, the T4 is produced by the thyroid gland. The other name is the thyroxine, okay? Thyroxine. Okay, so I want you to see this, please. This is in relation of the we are going to see about the calcitonin. Okay, so please pay attention to this. So here we have a vessel. This is a vessel. This is the calcium. The normal calcium values is going to be 8.5 to 10. Then you have an increase of calcium in blood. What happens if you have an increase of calcium in blood? They are going to appear the thyroid gland, and the thyroid gland is going to be stimulated by the elevation of calcium in blood. And we want 8.5 to 10. But in this case, we have more than 10. In this case, we are going to have the homeostasis of calcium. So increased levels of calcium stimulate the thyroid gland, and the thyroid gland, what is producing is the calcitonin. So who stimulates the thyroid gland to produce calcitonin? Is the high levels of calcium. The calcitonin then is going to stimulate whom? The bone, go to the bone, and the bone is going to stimulate the osteoblast. What is doing the osteoblast? The osteoblast is going to take the excess of calcium into the bones. And that is going to take, again, if they take the excess of calcium to the bones, the calcium returns to normal values between 8.5 to 10. Homeostasis of calcium. Let's talk about the PTH. Here we have a vessel again, and here we have calcium normal values, it's 8.5 to 10. Then what happened? The calcium levels is going to be less than 8.5, so it's very low calcium levels. And these low calcium levels, what it's going to do is going to go, can you see this arrow pointing to this yellow? That is the parathyroid gland that is behind the thyroid gland. So this is a back view. So this parathyroid gland is going to do what? They're going to produce the PTH. The PTH is going to stimulate going to the bone, and the PTH stimulate the osteoclasts. And the osteoclasts, what they are doing is taking calcium from the bone and put it into the blood. And that is going to return to normal values of calcium. That is the homeostasis of calcium. All right. So I think we covered mostly everything today. So any questions, I will be more than happy to answer during the lecture on Monday. All right. So let me open microphones. Just a moment, please. Okay. Let me open microphone just a moment. San Juana, can you hear me? All right. So
Yes, I can hear you.
thank you so much. Any question, please? Nita,
I don't have any questions.
Naomi, Michelle, Marjorie. There's two Marjories. Catherine, Catherine, Jesus, Jessica, Harjit, Jennifer, Alba. Yes, Alba. Yes, Beth, you are raising your hand. Thank you so much. Jessica, Diana. We have about 20 students who came, so if there is no any other question, please, I will be. Hello?
Will there be any diagrams at the exam?
I cannot say that.
Okay.
All right.
Thank you, Dr. G.
Thank you so much, everybody. So I will see
Thank
you
you.
Monday, and thank you for your effort and for enthusiasm and for your time. See you next time. Thank you so much.
Bye.
Bye-bye.
Bye, bye, bye.
Bye.
Thank you.
Good night.
Good night.
Good night.
Oh,
Good
by the
luck.
way, I'm going to post it in YouTube, so in the next hour. Thank you.
Thank you.
All right, thank you.